Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class let us see what are the effects of hyperuricemia. हमने last class में we learned what is hyperuricemia, what are the causes for hyperuricemia. But it is not that increased level of uric acid only causes gout, but there are various other changes which can occur in the other organs of the body whenever there is high uric acid. So we call more than 7 milligram per deciliter of uric acid in men and more than 6 milligram per deciliter of uric acid in women as hyperuricemia. So let us see what is the effect of high uric acid and its relation with the hypertension or blood pressure. So what happens is this uric acid, I have told you, it causes endothelial damage. So it causes oxidative stress, it causes inflammation. So all this can cause increased blood pressure. The uric acid can damage the kidney by activating the renin-angiotensin system, which can lead to renal blood vessel constriction, and this can increase the blood pressure. It also causes oxidative stress by causing endothelial dysfunction. It causes inflammation in the endothelium of the kidney. It causes smooth muscle proliferation and also causes mitochondrial dysfunction. Because of all this, अगर आपका uric acid ज़्यादा हो गया तो that can also lead to high blood pressure. हम लोग क्या सोचते हैं, if uric acid is high, only gout, there is no other condition associated. ऐसा नहीं है. Uric acid can also cause increased blood pressure because of all these mechanisms. So you can see here how this hyperuricemia is causing endothelial damage and dysfunction, which is causing increased resistance and hypertension, how it is activating the renin-angiotensin system, and how it is causing the smooth muscle fibrosis and then causing hypertension. So uric acid can also affect the heart. अभी आपको पता ही है कि uric acid से BP बढ़ सकता है, and when BP is high, it can affect the functioning of the heart. It will put the load on the heart, and also because of this high uric acid there is damage to the cardiovascular system, damage to the heart muscles because of inflammation, oxidative stress, mitochondrial damage, etc. It can damage the heart. It is inflammatory. Uric acid is inflammatory. So what happens is that can also lead to cardiac dysfunction. So high uric acid can also affect the functioning of the heart. आपके heart के problems भी आ सकते हैं अगर आपका uric acid बढ़ा है तो. Similarly, uric acid also causes insulin resistance. यहाँ पे आप देख सकते हो in the neck how the skin has become blackish because of this insulin resistance. And how this causes insulin resistance? It can lead to oxidative stress, which will affect the expression of the insulin genes. Insulin production में ही expression of the insulin genes को ही affect कर सकता है, and then the insulin resistance might develop. It causes inflammation in the adipose tissue, in the fat tissue, which will reduce the production of adiponectin. Adiponectin क्या करता है? ये insulin sensitivity को ज़्यादा बढ़ाता है. But because of the inflammation, there is reduced production of adiponectin. So it will cause impaired vasodilation. Because of this high uric acid, it will prevent the insulin from stimulating the vasodilation. This is important because जब ये vasodilation होगा तभी ही हम ग्लूकोज को skeletal muscles के अंदर ले सकते हैं. But जब vasodilation ही नहीं होगा, then we cannot take the insulin inside the muscle tissue, and then insulin resistance develop. It will cause islet cell dysfunction. So all this can cause insulin resistance resistance and diabetes. So local inflammation हो सकता है, it will cause reduced adiponectin production, it will cause mitochondrial dysfunction and liver dysfunction, it causes impaired glucose intake and islet cell dysfunction. All this can cause insulin deficiency or resistance to insulin, which will help that a person develop diabetes also. So increased uric acid level can also contribute to high blood sugars by affecting the insulin sensitivity. Similarly, increased uric acid can also cause the non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease is nothing but the deposition of fat in the liver. When it extends beyond a limit, it causes inflammation and fibrosis. So this liver is the one organ which produces the uric acid, and whenever the uric acid level increases, it will also lead to formation of this alcoholic fatty disease by causing inflammation, oxidative stress and fibrosis in the liver. So this is how the normal liver looks like, and this is how a non-alcoholic fatty liver looks like in cases of increased uric acid. So in serum, increased uric acid can cause metabolic syndrome, insulin resistance, that can cause the reactive oxygen species, which can damage the liver and cause non-alcoholic fatty liver disease. It can cause inflammation. All this can lead together to non-alcoholic fatty liver disease. Uric acid can also cause kidney damage, because when the body produces too much of uric acid and the kidney can't remove it, uric acid will start building up in the blood. So as the blood will filter through the kidney, uric acid will start forming such crystals in the kidneys, and they can damage the kidney. Urate crystals can deposit along the collecting ducts, and they can cause progressive renal damage, reducing the GFR. And it can also activate the renin-angiotensin system and cause hypertension, that again can cause damage to the kidney. So renal artery injury, renal artery fibrosis, hypertension, all of these can cause kidney damage. So hyperuricemia say kidney damage can also happen. So this is you will see that hyperuricemia, which will cause increased oxidative stress, increased endothelial dysfunction, which will cause systemic glomerular hypertension, reduced renal blood flow, that causes decreased GFR. And once the decreases in the GFR occurs, then there will be again decrease in the excretion of uric acid. And once the uric acid start building, the cycle continues. So these are the uric acid stone. You'll get pain in your lower back, or you might feel vomiting, nausea, fever, chills. You might see blood in the urine, pain when you are peeing. So all this can occur in case of kidney stones. So uric acid stones can also be formed when there is hyperuricemia. It also causes changes in the brain. So increased uric acid is capable of causing changes in the brain, that is because of oxidative stress. So ये oxidative stress के वजह से it will damage the cells there, and it can cause cognitive impairment and neurological issues. So it can cause inflammation in the brain. It can alter the brain activity. It also can cause neurological symptoms like poor muscle control, mental retardation, self-mutilating behavior, etc. Because of all these parameters, oxidative stress, inflammation, altering the brain activity, etc. So this is the brain here, which you can see, and exaggerated angiogenesis and blood-brain barrier breakdown can happen because of this increased uric acid and changes what it causes in the environment there, and because of which क्या हो जाएगा, एंडोथेलियल डैमेज हो जाएगा, फाइब्रोसिस हो जाएगा, इन्फ्लेमेशन हो जाएगा, यहाँ पे स्ट्रेस हो जाएगा, and there can be even stroke, paralysis, etc. that can also happen because of this increased uric acid. So next would be obesity. So high uric acid, usually high uric acid happens when we take purine rich food. So purine rich food usually includes what? Seafood, fatty food, beer. So all these high fatty foods, they themselves can contribute to obesity. And also uric acid can increase the production of fat in the liver and in the periphery. This is because the enzyme xanthine oxidase reductase, which is responsible for uric acid production, also increases the deposition of the fat in the adipocytes. And as we know, increased uric acid can cause gout. So what is gout? Gout is nothing but when the urate crystals gets accumulated in your joint, you will get this attack of gout. So urate crystals form here, they deposit, they cause inflammation, and then you get this arthritis. So these are the stages of gout. We will study in detail about the gout in the next classes, but remember, just because your uric acid is high doesn't mean that you will have gout. There can be high uric acid, but there can be no symptoms at all. So sometimes patient have high uric acid but absolutely no symptoms. Sometimes you get acute attack of gout. Sometimes it turns chronic tophaceous gout. So uric acid just doesn't cause gout. There are many other organ damage which it causes because of the inflammation. This uric acid crystals causes inflammation in the body. Because of this, there is an oxidative stress. There is reactive oxygen species being generated. It causes endothelial damage. It will damage the lining of the blood vessels. It will activate the renin-angiotensin system, because of which the blood pressure, the kidney function changes. It also alters the fat level in your body. It can cause dyslipidemia. All of this, the inflammation, oxidative stress, endothelial dysfunction, RAS activation, dyslipidemia, can cause insulin resistance, hypertension, atherosclerosis, deposition of the fat. It causes dyslipidemia. And because of these factors, patient can have cardiovascular disease. So uric acid can cause heart problem. High uric acid can cause stroke because of the damage of the blood vessels in the brain. High uric acid can cause diabetic retinopathy. It can damage even the blood vessels of the eye, and it can also cause diabetic nephropathy. So all these are the effects of high uric acid in the body. So just don't think that gout is the only manifestation when you get increased uric acid. Increased uric acid as having lot of other comorbidities also. Increased uric acid can cause other organ damages also. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.